Health care, human right. Health care, human right. Health care, human right. Health care, now.
On a February day, 57 years ago, 1,200 North Carolinians packed into White Rock Baptist Church in Durham to listen to Dr. King. And he praised students who at the time had started the country's first sit-ins to end segregation. And he said that he hoped that their willingness to stay in jail would, quote, arouse the dozing conscience of our nation. There are still many more to awaken. And so next Tuesday, through mass nonviolent civil disobedience, we must awaken the Tar Heel conscience, the American conscience.
We're coming to dramatize a shameful condition. And if you're healthy a little bit, you ought to come, because one day you might get arrested by sickness.
Because it doesn't matter who you are, if your father was in the military or where you were born or where you live today, health care is a human right. That's right. It is a right for all people.
Because NC did not expand Medicaid and management would not hire us for full-time work, these nursing assistants could not afford health insurance. This is a shameful way to treat those who wash the body of our elders, aged and infirm, and give out medications that they themselves cannot afford.
If we had had this, we would have 45,000 fewer causes of untreated depression. We would have 27,000 more cases of persons who have been diagnosed with diabetes. We would have 12,000 more women ages 50 to 64 who would have mammograms. If we had Medicare expansion, we would have 27,840 more women who could have pap smears.
The working class is working hard and making money for the medical insurance companies, pharmaceutical companies, and even co-pays for the doctor's visits. While they're rising, the prices are rising. Health care slavery.
In a Trump care world, only the wealthiest can survive, because only the wealthiest can afford to pay up front, and only the wealthiest can afford to wait for a rebate.
Both Senators Burr and Tillis are millionaires, and yet they receive taxpayer-subsidized health insurance.
Thanks, Charlie.
Now, they want to take that away from hundreds of thousands of North Carolinians who receive ACA health insurance.
It means that Republicans like Senators Tillis and Burr are voting to kick us when we're down. It means that when we've got the short end of the stick, President Trump wants to set that stick on fire.
So no one should be worried sick that they might get sick.
That's right.
But I'm not worried about what I have. But I do worry about others that are not able to take care of themselves. It's not about just taking care of ourselves. It's about taking care of everyone.
That's right. That's right.
We are all members of one another. And when the health of one member suffers, the health of the whole body is lowered. We're all in this mess together. So together we need to tell our senators to demand a transparent process and preserve affordable health care.
And power conceives nothing without a demand. Millions of people could die, and even if it was only one, that is too many.
We must stand. We must fight. We must end this type of slavery right now.
Our Constitution in North Carolina says beneficent provision to the poor is the first duty of a civilized state, which means that when you don't care for the poor as a politician or policymaker, you are acting in an uncivilized way.